procedure, the laser assisted new attachment procedure. We switch on the laser from this red button on the top, press it once, then it will open up. Make sure to give the patient the goggles for protection. The assistant also should wear one, and the doctor also should wear one. And not a lot of assistants or doctors without the goggles should be present in that room. We have to make sure of laser safety. Then make sure that this wire and everything doesn't get stuck anywhere when you're working. It should be properly maintained. This is a fiber optic. The passcode of the laser is 00000 6 times 0. You press done. Then you go to the treatment menu. In the treatment menu, you will see a lot of treatment objectives already stored here. We want to go ahead and we want to go on the fourth page, and there will be circular debridement. So we click that circular debridement and we press on done. Once you press on done, a preset mode of the laser will be set. It has a power of 0.8 watts. I like to keep it at 0.6. This is more than enough for doing Lanap. Then the timer is set at 30 seconds. You can do it for 2 to 3 minutes for the whole mouth, maybe 4 to 5 minutes also. Or if you are treating only one surgical site, make sure not to exceed 30 seconds. Then the pulse mode is continuous or pulse. So I like to keep it at continuous only. So this is continuous. So I just increase the time which I want the laser to work for, and now I press the button standby. So when it is orange it is ready, when it is standby it is not ready. पॉज किया ना? पॉज ही किया ना, बंद नहीं किया ना? ठीक है। तो निकाल देते हैं। So while before starting the laser, we have to activate the tip. Make sure your goggles are on. The tip, the fiber optic must be clean. If it is not clean, cut it a little bit with the scissors. And then there is a foot control, which is a wireless foot control. Only when the machine isn't ready, it will work. You take this cork, a piece of cork, and you press on it, and you will see some fumes eliminate coming out. It means that the laser is activated. Now we go to the patient. We were very careful not to press the foot switch. Now whichever papilla is slightly inflamed, that area we will insert the laser tip a little bit. If you want to extend the laser tip, we can extend the laser tip by slightly opening this knob and taking this laser tip out or in depending on your comfort, and tightening it back. Now we are selecting, we have a slight inflammation in the canine and lateral incisor area. We will insert the tip of the laser inside the papilla, inside the sulcus, inside deep, and then we will activate it and we will keep moving it for 10 seconds. So I have inserted it and now I am activating it. Make sure to do the activation or position the laser away from the tooth, not towards the tooth. Otherwise, it can lead to pulp changes in the tooth, especially in cases of a treated tooth or root exposure. And make sure to always keep the tip of the laser moving. It should never be stable at one point. You have to keep the tip of the laser mobile. So here I am actually going ahead and disrupting the junction epithelium properly with the laser. Open, auntie, open कीजिए बड़ा. Wherever there is bleeding, you have to wipe off the blood first, and then you have to insert the laser tip deep inside the sulcus. Now in her case, there is one more area where we have found out there is some inflammation. There is a very shallow pocket, about 3 mm, 4 mm of pocket which is present, which we will properly debride. We have already done scaling and root planing for the whole mouth. This laser step only happens after thorough scaling and root planing. Like all the plaque and tartar should be completely gone. Only then the laser will have some good effect. Now I am inserting it into the interdental papilla. Again I am moving. Pain or anti? Okay. Slightly I am moving here and खोलिए, and then I will do it inside. Pain है? बस हो गया, बस इतना ही करना था। बंद कीजिए थोड़ा सा, बंद कीजिए। हाँ, नाउ वी कैन ऑल्सो मूव, थोड़ा सा ओपन, हाँ थोड़ा सा बंद, बस। नाउ वी कैन ऑल्सो मूव द लेज़र slightly on the gums with non-contact mode, and we keep cleaning the laser in between with cold saline and gauze. We use it in non-contact mode for low-level laser therapy. We don't touch the gums, touch the laser to the gums. Wherever there is good amount of inflammation, we have done the contact mode laser where we have inserted it inside the papilla. But here we don't need to really insert it. We can just move it around in the cervical area. This will also reduce the sensitivity of the patient. Again, don't keep it at one point. You keep moving it so that the laser energy is dissipated over a large area. Latent heat production is not there. We just run it for about 1.5 to 2 minutes like this. For 1.5 to 2 minutes for 6 teeth is more than enough. 10 to 20 seconds per papilla is more than enough.